She did not know about the pregnancy. I always tell people pain that wakes you up out of your sleep, you need to pay attention to. She was actively bleeding into her abdomen.
Welcome to this week's episode of the Black Birth Stories podcast. I'm your host, Dr. Tiffany Woodus. I'm a wife, a mama, and a board-certified OBGYN on a mission to help eliminate women's health disparities and improve Black maternal health outcomes. I help you take back control of your birth story without the fear of becoming a victim of the Black maternal health crisis. Each week, we amplify the voices of Black women in our unique birthing experiences, creating an environment for learning, for healing, and for empowerment. Be sure and follow us on Apple Podcasts, Spotify, and YouTube so that you don't miss an episode.
Interesting things I saw on call this weekend, part 1. The first is a ruptured ectopic pregnancy. So the story goes like this. I had the pleasure of actually meeting this mama before. I wasn't her primary OB-GYN, but I was rounding, covering for a partner, and I discharged this mama home from the hospital 3 months ago after her first C-section. Well, she comes back into the ER, this time complaining of severe pain that woke her up out of her sleep, and she was found to be pregnant. She did not know about the pregnancy, which makes sense, right? She probably did not have what she would consider a normal period after having just given birth 3 months ago, right? We expect that moms will have irregular bleeding for about 6 weeks on average after a delivery. And if this mama was breastfeeding or nursing, she might not have had a cycle, or she may have had irregular bleeding, which is common because we don't ovulate consistently. When we are breastfeeding, and going long periods of time without ovulation leads to either the absence of a cycle or irregular, unpredictable cycles. So this mama came in with severe pain, severe abdominal pain, severe chest pain. I always tell people pain that wakes you up out of your sleep, you need to pay attention to. Do not ignore it, because that's pain on another level. And she was found to have a positive pregnancy test. We checked her pregnancy hormone and it was significantly elevated. Then we did an ultrasound and a CAT scan of her pelvis and abdomen and found that there was no evidence of a pregnancy in the uterus in the right place where it should be. But we did see what looked like a complex mass involving her left side where her tube and ovary was, that could possibly be consistent with an ectopic pregnancy. Ectopic, that word means outside. So a pregnancy in the wrong place where it should not be. And that is a true obstetrical emergency. So in this particular case, she had a pregnancy that was growing and developing in her left tube. Well, because that is not where a pregnancy should grow and develop, at some point when that pregnancy progresses, it gets too large, it outgrows the available space in that tube. And in this mama's case, it ruptured that tube and she was actively bleeding into her abdomen. So thankfully, by the time I saw her, she was looking good. She was a young, healthy woman, so she had her youth going for her. But in someone who maybe is not as healthy or has some pre-existing medical problems, you can go downhill extremely quickly. But this mom looked good. Her pain was severe, but her vital signs, as in her blood pressure, her heart rate, looked good. So when we're losing too much blood, a lot of times it can make our heart rate shoot up because your body's trying to make up or compensate for the blood that it is losing. It can make your blood pressure go down low. These are things that we look for in terms of what we call hemorrhagic shock, or where your body's in such distress because it has lost a significant amount of blood. So I had a conversation with this mama and told her, look, we need to go to the operating room. Under other circumstances, there are other treatments we could consider for this condition. For example, there are medications that can help to resolve an ectopic pregnancy, but we had passed this point. At the point where she was actively bleeding into her abdomen, the only acceptable treatment was to go to the operating room. She understood and consented to go to the operating room. We did what's called a laparoscopy, which is where we take a camera and look in the abdomen in order to identify the problem and come up with a plan of care to fix the problem. So she underwent this procedure. When I got into the OR, I was encountered with a massive amount of blood. Blood that filled her entire abdomen, all the way up to what we call Morrison's pouch, which is the space in between the liver and the kidney. So that gives you an idea of how much blood was in her abdomen. We ended up estimating that it was about 500 cc's, or half a liter of blood. So we initially cleaned all of the blood out of her abdomen. And then I was able to see and identify the damaged tube on the left side with the pregnancy. And because that tube was damaged and bleeding, we had to take that tube out. And that immediately fixed the problem. So then just spent the rest of the time cleaning out any additional blood and clot out of her abdomen. And then that mama did well. We saw her the next day. She looked like a brand new woman. Her pain was gone, praise God. And she was doing so much better. So I told her, I'm just so thankful that you listened to your body. You did not ignore the whispers. You do not want your body screaming at you. You want to pay attention to what is going on with your body. She sought medical care immediately. She was listened to. Thank God I was on duty. And so she, felt reassured that she was seeing a familiar face. That took down some of the anxiety and the fear and the worry with, stepping into a medical setting, because it can be so intimidating for us as Black women. And we were able to identify her concern and treat her concern immediately. She did well. She went home without any concerns, and she's going to follow up when it's appropriate.
Thank you so much for joining us this week. Do me a favor and share this episode with a mama who you know would benefit from the learning and the healing and the empowerment that happens each and every week on the Black Birth Stories podcast. We'll see you next week.